now we're going to start on chapter 15 and move out of the upper extremity and off into the neck and the trunk. So a couple of things just to remind you about. There are vertebral curves, 3 vertebral curves that are shown in your book, and it's not on page 212 actually. Let me find it. It's on page 240. So make reference to that. You can see those vertebral curves. Now as we look at this particular image from the side view, you'll notice that the cervical vertebrae are convex towards the front of the body, and the thoracic are actually concave, and the lumbar are again convex. A few terms important for you to understand. The spine is the bony the bones that the spinal cord travels through, and so oftentimes we interchange those words, but important for you to understand that spine is different from spinal cord. A facet is a smooth area, a flat surface on a bone, and there are many superior and inferior facets, and we'll see a picture of that in just a moment. A facet joint is where those two articulate, and there is a piece of cartilage between those surfaces. Some motions that we need to be familiar with. We've got flexion, extension, and hyperextension. Now the trunk and neck both have the same motion. So we have flexion, extension, hyperextension. We lateral bend to the right and lateral bend to the left. We rotate towards the right where our face turns towards, or to the left. All right, so here we can see the superior articular process and the inferior articular process. And the inferior obviously is the one that's positioned towards the ground, the superior towards an upward position. Within the vertebrae, just a reminder, there are 7 cervical, 12 thoracic, 5 lumbar, and the sacral area has 5 as well, but they're fused. Now, in general, we would expect these all to look very similar to each other. And so let's take a look at the parts of the bone. So we have the body. We also have a transverse process and a spinous process. And you guys have already located those in terms of working through some of the details of putting clay on your skeleton. So it's good review. We have a neural arch. The neural arch is this area here where the nerve supply comes out and travels up and down the spinal column and goes off to different areas that it feeds nerve supply. We have a vertebral foramen, which is a hole, and we have a pedicle, which is this portion here. The pedicle is the part between the body and the transverse process there. This area here is noted, it's called the lamina, and this is between the transverse process and the spinous process. A couple of things to review on the skull. We have the parietal bone, the temporal bone, the frontal bone, and then the occipital bone. And then at the base of the occipital bone, at the base of the temporal bone is the mastoid process, and that's going to be an important point of connection for some of the muscles that we're going to talk about. The foramen magnum is a very large hole, obviously, where the information travels between the brain and the spinal column. All right, we've got discs, cartilaginous discs. We got 23 of them. They absorb the shock of the our day-to-day activities that we do. Very important for that. They also provide us some flexibility, but as we know, we don't have a ton of flexibility, or we could actually just bend our spinal cord and create all kinds of problems. So we do have a lot of ligaments along the spinal column. The discs, however, are important to understand that they do make up 25% of our length in the vertebral column. So as we get older, those discs tend to compress a bit, and we lose some height. Couple of important vertebrae to bring your attention to. The atlas is the number one top vertebrae, supports the head, and the axis is number two. And on the axis is something called the odontoid process, or we also know it as the dens, and that's the pivot point for the atlas. So there's the atlas and the axis with the odontoid process right there. Okay, so in terms of joints and ligaments, the atlanto-occipital articulation is the place where the atlantis and the occipital bone of the skull come together. Then the connection or the joint between the axis and the atlas is called the atlantoaxial articulation. And you'll remember we talked about this particular area being quite unstable, especially in people who have Down syndrome, where they have particularly low tone. This is a pretty unstable point, as everything pivots on that dens or the odontoid process. So we have lots of muscles and ligaments to help keep everything very stable so that we don't dislocate that. But as we know, in kids with Down syndrome, we have to be careful about things like somersaults and diving, things like that. So we talked about that in peds. We have facet joints, which are at each of the vertebrae between the inferior and superior facets. We already mentioned that. And then, as I said, multiple ligaments to prevent excessive hyperextension and also excessive hyperflexion. Okay, so flexion is important in the trunk and the neck, but we have those ligaments to help prevent us from overextending or overflexing. A couple things about pathology. Lordosis is an increase in the lumbar curvature of the spine. So I will demonstrate these in class, but basically what happens is you end up having a very extreme curve in your lower back, which causes you a great bit of difficulty in a number of functional types of activities. Kyphosis is the opposite. It's a curvature in the thoracic spine, which actually causes your shoulders to hunch over and you end up sort of looking toward the ground. So I say lordosis is like you're looking at the sky, like at the Lord, and kyphosis is the opposite, sort of that rounded over posture. We'll go over that. Scoliosis is a curvature away from the center in either direction from side to side. And a couple of other things that are important to understand. The biggest point of injury tends to be in the lumbar spine at L4, L5, or between L5 and S1. Most movement occurs here, and this is where we see a lot of discs herniate. And I will show you in class why this is significant, because we load our body weight through that center of gravity, which really just sort of pulls everything out of whack at that particular area. Okay, take a look at the muscles. We're going to go over these again in class. The sternocleidomastoid. Sternocleidomastoid is a muscle, very strong neck flexor, and it attaches at the sternum and also attaches on the clavicle. And it is responsible primarily for neck flexion. However, that's when both of the muscles on both sides of the head contract at the same time, the head and neck will flex. When we just contract unilaterally on one side, we get rotation to the opposite side or lateral bending to that side. The scalenes are some very small little muscles in the neck that are also, when they contract together, create neck flexion, and when they contract unilaterally, create lateral bending to the same side. Prevertebral muscles are a bunch of small, tiny little muscles. We're not going to build these on the skeleton, but they run, there's lots and lots of different groups of them. They are primarily responsible for stability and good, stable postural control. The erector spinae group is responsible for extension of the neck, the trunk, as well as lateral bending when they are turned on unilaterally. And you can see a picture of those on page 255. The splenius capitis and the splenius cervicis are two sets of muscles that are important for head and neck extension and trunk extension. So the splenius capitis is, I'm sorry, not trunk extension in this case, head and neck extension. So in specific, extension of the head is the splenius capitis because it does attach directly to the skull. And then unilaterally responsible for rotation and bending. The splenius cervicis incorporates more than the head, and it's the neck as well. So it's extension of the neck and head, and there should be a comma there, as well as rotation and lateral bending when it's turned on, when they're turned on unilaterally. As we look at the trunk muscles, and let's take a look at, we are looking at this from the most superficial point to the most sort of deep point. So your rectus abdominis muscles, actually rectus abdominis, external obliques, internal obliques, and transverse abdominis are all muscles on the front side of the body. The erector spinae muscles extend the length of the trunk, a very small little group of muscles that are responsible for trunk extension. So you can see why people hurt their back quite a bit. We've got these massive muscles on the front. As we look at the rectus abdominis, that originates at your pubic bone, at your pubic crest, and goes almost in a straight up and down fashion towards the ribs. So then we have the external obliques, which are just beneath the rectus abdominis, and those extend from the linea alba to the ribs. No, I take that back. Yes, I think that's correct. Anyway, as we have the internal obliques, those are also very strong trunk flexors, and those extend from the iliac crest to the linea alba. So they run in two different diagonal patterns. Transverse abdominis are the most deep set of trunk muscles, and those essentially just hold all your insides in place very nicely. So lots of trunk flexors. Last muscle I want to talk to you about in terms of this is the quadratus lumborum. The quadratus lumborum is responsible for lateral bending of the trunk. There's a good picture of it on page 258 in your text, and it runs from the iliac crest up to the base of the 12th rib, as well as the transverse processes of your 5 lumbar vertebrae. Now, this is an important muscle to laterally bend the trunk to the right or to the left. However, it is an extremely important muscle to help keep your hip up when you swing your leg through. And so we use a reversal of muscle action to actually bring the origin towards the insertion, and particularly when we think about somebody who's walking with a long leg cast, as they have to keep their hip up while they swing their leg through.